What would you say to Americans who are kind of not really in a rush to get the vaccine? Because before it was maybe lack of access, but now that it's available, what would you say to those people who aren't really that excited or motivated to get it?
Yeah, well, what we have to do is we have to get what we refer to as trusted messengers who they trust in the community, to explain to them why it's important, not only for their own personal health, because, often people feel they're invulnerable, and then they wind up getting into situations that they wish they had been preventing that. The other thing is that you want to get vaccinated, Eva, first because of your own health. We've lost now 570,000 people have died in this country from this pandemic. This is the worst pandemic of an infectious disease in over 100 years. So what we're going through is something that really is historic. That's the first thing. But then also, you want to make sure you're not part of the propagation of the outbreak, because if you get infected, even though you don't get any symptoms, you say, well, fine, I don't get infected, so who cares? Don't bother me. I'm just worried about myself. But you've got to realize that if you get infected, even if you don't get any symptoms, you could inadvertently and innocently pass it on to someone else, who would pass it on to someone else, who then may pass it on to someone who's really susceptible, someone's mother, father, child, husband, wife, who might have an underlying condition that would make them very susceptible to a severe outcome. So when people say, I don't want to do it, you don't want to be confrontational with them. You want to say, let's explain why you don't want to do it. And it's better to get trusted members of society. We have a program, Eva, called the COVID-19 Community Core, which is thousands of community people that are trusted. They could be athletes, they could be famous personalities like yourself, they could be clergy and others that people actually trust more than they would trust something coming from a high. People trust their own doctors, people trust their pharmacists. Those are the ones that they should go to and say, what do you think? Yeah. Should I get vaccinated? That's the way I think we can approach these people.
Yeah, I mean, I think that people are looking to, medical experts, and unfortunately, I feel like the internet and social media is circulating a lot of misinformation that feels like it comes from credible accounts. And so, I would encourage everybody to ask your general doctor. I guarantee you, they will tell you to get the vaccine.
Absolutely, that's great advice. That's what we talk about when we say trusted messengers. And for many people, their own private physician that's been taking care of them and their family for years is a trusted messenger.
Yeah. Now, what about now that the vaccine has opened up for 16, 17-year-olds, as parents of 16, 17-year-olds, is there anything that parents need to know, reactions for younger folk, anything different for 16 or 17-year-olds?
No, it's the same as for young adults, as for middle age. The vaccine is extremely efficacious in young people, in intermediate level of age, and in elderly. It's really, I think that's one of the reasons why we get frustrated when we hear misinformation that gets people thinking about not getting vaccinated, is that we are very fortunate that we happen to have several highly efficacious vaccines that are really saving lives and preventing people from spreading it. So it would really be unfortunate if we don't utilize it to its maximum.
And talk about those 3 vaccines, because a lot of people, another reason people don't want to get it is because they're waiting for the Pfizer, or they're waiting for the Moderna, or they're going to I just want to do the J&J because I read this or that. Is there quite a big difference, or should you just go out and get the one that you can get?
No, I think you said it just perfectly, Eva. That's what I'm telling people, is that the most important thing is to get vaccinated. All 3 of these vaccines are highly efficacious and are proving to be highly effective in the real world. Some people have a preference for a one and done, and they may just want a single shot. those are ones that might want to get the J&J. Some like the idea about the Moderna and the Pfizer being a new, exciting type of a vaccine. For me, if I were going to go into a place, I would take the vaccine that was available to me at the earliest possible convenience.
Right, right. And now I got a question from social media, and I've heard this. I got it about 5 or 6 times. But as a parent of children under 16, they want to know, how do we protect our children under this new CDC guideline, and how do we shift the way, as guidelines are shifting the way we go about our lives? What about that 15-year-old? What about the 8-year-old? How do we protect the others?
They're all absolutely appropriate and good questions. So first of all, Pfizer has already done a study in 12 to 15-year-old, and it's shown to be extraordinarily effective and very safe. So high school level kids, adolescents from 12 to 15, we already know it's safe and effective, and Pfizer will very soon be trying to get a supplement to their EUA so that they could start administering it to high school kids. That's important because we want to make sure they're all protected by the time we start the fall term at the end of August. For younger children, what we do is, because children are susceptible. So the two groups that are vulnerable people are pregnant women and children. And the general rule with vaccines is that before you give it, and give it confidently to these people, you want to make sure that it's safe and effective in a normal adult population, which has already been done very, very clearly. So then you do it in younger kids in what's called the dose escalation. So the studies we've already started, you go from kids from 12 to 9, that looks good. Then you go 9 to 6, that looks good as you go 6 to 2, and then you go 6 months to 2 years. That entire process takes several months. So we're predicting that by the time we get to the end of this calendar year, that we will be able to vaccinate children of any age. And by the time we get to the end of the summer, or even sooner, we'll be able to vaccinate high school kids.
That's good. Great. You mentioned this, and I've seen it in the comments a lot about pregnant women. And so I do know a lot of women who are worried about, if they are pregnant, they should not get the vaccine, or if they want to be pregnant, you know, it makes you sterile. It does that. So much misinformation about pregnant women and women who want to be pregnant.
Okay, so let's take them one at a time. First of all, this idea about making someone sterile is nonsense. That is the epitome of misinformation based on no reality at all. And that's unfortunate because there's a lot of misinformation going on. But the situation with pregnant women, even though it has not been formally tested in a clinical trial in pregnant women, because remember I mentioned a moment ago, the two vulnerable groups that you want to make sure it's safe and effective in people who are adult normal before you do children and pregnant women. However, since COVID-19 disease is very dangerous for the health of a pregnant woman and very dangerous for the outcome of the pregnancy, that women have elected to go ahead and get vaccinated anyway, even though it hasn't been recommended yet. And literally, Eva, tens and tens of thousands of women who are pregnant have decided they wanted to get vaccinated, because the American College of Obstetrics and Gynecology say you should not withhold vaccine from pregnant women, because the consequences of getting infected with SARS-CoV-2 are really bad for pregnant women. And the CDC has been following this, and they have found that there's no red flags of concern among the many, many women who are pregnant, who were vaccinated. So that's what we say. Women who want to get pregnant, fine. There's no effect at all on the ability. I mean, that's another misinformation that gets transmitted, that somehow it's going to get involved in your sterility and your inability to, that's absolute nonsense.
For all of them, for all three vaccines, that's nonsense.
Right, exactly.
Okay. And then speaking of the variants, because you spoke about the variants, you know how we get the flu shot every year. Is this going to be, are we going to get the COVID shot every year from here on out? And, or do we need booster shots for these South African variant and the UK variant? And, you know, for us who are vaccinated, what do we have to know as well? Do we have to get another shot?
Yeah. That, again, all important and highly relevant questions. The answer is, I would not be surprised that as the level of protection wanes over a period of time, that we will have to get boosted. I don't know how often yet, Eva. We know that the duration of the protection lasts at least 6 months and likely considerably longer. But I would not be surprised if after a year, or maybe even a little sooner, or maybe even a little later, you hear a recommendation to go ahead and get a boost to keep the level of immunity high. The other reason you might need a boost is that if variants start emerging among us or coming from another country that is not protected as well against the vaccine that we've been vaccinated with, then you might want to give them a boost that is specific for that particular variant. So bottom line, the vaccines are extraordinarily protective right now. Mm-hmm. The durability is not indefinite. It's not going to go on forever. So it is likely we will have to at some time get a boost, both for durability and in case we get variants that are troublesome.
Yeah. I want to talk a little bit about the Latino community because, you know, we've always been disproportionately affected with healthcare, whether it's access to healthcare. We haven't always been treated well by the healthcare system as well. And so there is a hesitancy to trust in the opinions of doctors or to trust that this vaccine is safe. And so you do see low vaccination rates in Latino communities. What are y'all doing to combat that? And how can you and I right now tell the Latino community it is important for all of us, especially because many of us are multi-generations living in one household. We do have abuela, you know, who could be highly susceptible. We do have, you know, parents who work full time. They can't take time off to go wait 4 hours at a Alamo Dome to get the vaccine, or they can't take 2 days off because there may be side effects. I mean, there are so many reasons why people from my community do not want to get it. And I want you to speak to those people.
Okay. So I'm speaking to them right now through you. So we made the first step in what you're suggesting. So thank you again for having me on your Instagram. So having said that, is that it would be doubly tragic. Everything you said is so true, that the Hispanic community has been underserved with regard to access to healthcare. And all the things you said are absolutely correct. It would be really terrible if the Latino community deprived themselves of the protection against something that's disproportionately hurting them. Because if you look at the numbers, and data don't lie, it's a fact. Latinos get infected more frequently, mostly on the basis of the jobs that they generally have. They're in the community with essential services. Mm-hmm. They're in the construction business. They're in the landscaping business. They're in the housekeeping business. They're doing all of the things.
Farm workers.
Farm workers. I mean, my goodness, like, you know, the percentage of farm workers. So they're out there. So they're susceptible. Number two, importantly, because of the things that you mentioned, the social determinants of health, the lack of access to health care, they have a higher proportion of the underlying conditions that make it more likely that if you do get infected, you're going to get a serious outcome, you're going to have to go to the hospital, and you might die. So knowing that, how doubly tragic would it be that you're in a compromised position to begin with, and then for reasons that are not necessarily valid, but they're understandable, you don't want to get vaccinated. So why would you prevent yourself, your parents, your grandparents from doing something that would protect them from a serious illness? Mm-hmm. So you're asking me, how do we do it? You got to outreach to the community. And you do that by the trusted messages that you and I were talking about a moment ago. We've got to get the people that the Latino community trusts. Who do you trust? I mean, if I were a person living in a community that's mostly Hispanic, I wouldn't mind to see my favorite baseball player, you know, Juan Soto. I live in Washington, of the Washington Nationals, coming out and talking about why it's important, or an entertainer, or like yourself, or a clergy. I mean, the clergy is so important, particularly when you have the overwhelming majority of the Latino community are Catholic. So you would think the Catholic priest would be helpful in doing that. So you've got to outreach by the people who are trusted by the community.
Mm-hmm. Yeah. And, you know, we live in a global community. When you talk about community, you know, you don't just live in Texas. You live, you know, this, as we've seen, this virus has connected us all in a global way. And so just doing our part, not only for abuela who lives with you and for your coworkers when you go to work, and your state and your country, but you know, this global pandemic will not end unless we all do our part. And to the Latino community, you know, there are so many resources for them to now get the vaccine. There's so many ways in which you can get it. And so I'll put some information down below if people are confused as to, like, where do I go? How do I get it?
Yeah. Well, one of the things that you said early on that is really important is that there's no more priorities. No more priorities. Anybody and everybody can get a vaccine. Mm-hmm. And it does, no one will, like when you go say, well, I'm sorry, you're not in priority A or priority B. Anybody can get it. So what we're trying to do, and what has been a very important goal of President Biden and the medical team, of which I feel privileged to be a member of, what they're doing is they're trying to make it really easy to get access to vaccine. One of the things that the president and Vice President Harris is very, very much intent on is what we call equity, making sure that we don't have certain subgroups, be they Latinos, African Americans, or anyone, who don't have equal access and ease in getting a vaccine. You've got to be able to extend yourself to the community, whether that's through community vaccine centers, whether that's through federally qualified health centers, whether that's through mobile units that would go out into areas that are not easily accessible. Those are the kind of things that we're putting in place so we make it really easy for people. I had a great opportunity yesterday. I live in Washington, so I went up to Baltimore with Vice President Kamala Harris to visit the stadium that the Baltimore Ravens play. It is a massive vaccine center. And we walked in and there were hundreds of people, easy to park, go upstairs, get in line, get your shot, wait a half an hour, go home. It was like an amazing flow of people getting vaccinated. And the vice president herself came, and it was really a great scene because she is like you and I. She wants to get everybody to get vaccinated. And she spoke to them and they were just so excited to see her. It's those kind of things that we do to get people to get motivated to get vaccinated.
Yeah. Well, my family's reason enough for me to get vaccinated. I mean, I want to see my mom. I want to see, you know, my family. And so I think everybody should do it, not only for themselves, but for people that they love. Anybody you care about, you should get vaccinated. I do want to ask you about the Johnson and Johnson, because I feel like even I was confused of like, wait, it was paused and now it's not paused. And so I just want to, some people who got it felt panic, like, what, something's wrong, I got it. So could you walk us through what happened with J&J, and is everything okay to get it, get it?
Yeah. Okay. So again, a very relevant question because of what happened. So there is a system of surveillance that the CDC and the FDA does to look for rare adverse events. So the CDC and the FDA, by their surveillance system, saw one case of a serious adverse event with J&J, then 2, then 3, and then when they got to 6, they said, we don't know whether this is going to be common or it's going to be extremely rare. So in order to be overly cautious, let's call a pause, not cancel, but a timeout. Mm-hmm. And they did, so that they could do 2 things. They could look and see if there were a lot of others that were there, and they could warn physicians that when someone comes in with this adverse event, there's a very specific way to treat it. So here's how you should treat it. At the end of the day, the initial reason for the pause was 6 women between the ages of 18 and 48 had a complication out of 7 million people. So it was less than 1 in a million, which means there's a greater chance of getting hit by lightning than it is for that. Mm-hmm. So the pause was to be overly cautious. Mm-hmm. And then they said, this is so rare that if you balance the risk of getting COVID-19, the disease, versus the risk of getting a side effect from the vaccine, overwhelmingly, the risk of getting the disease was greater. So mm-hmm. therefore they said, it's such a rare occurrence, let's redistribute it again and call off the pause. Mm-hmm. So if you think about it, Eva, carefully, it's that we take safety so seriously that a pause was called for an adverse event that was phenomenally rare, which would get you to get more confidence that when the vaccines are distributed, they're really safe. Because if they mm-hmm. called a pause for something that was a 1 in a million shot, then you know we're looking at this really carefully. So that's right. The way you can look at it.
And it's totally safe. It's fine if you got it. You'll be fine if you got it. And if it's available to you, you should get it.
Right. Just get the one that's the most easily available to you.
Right. I want to ask you one last question, which I feel is the most important, is when will this be over? That's probably the other question I got the most on my social media was, when does this end? People want a finish line. They want to cross this finish line. And it's been over a year. So what could you speak to about that?
Well, it will end when the level of infection is so low that it's no longer a threat and you don't modify your behavior very much for it. That will happen when we get the overwhelming majority of the people vaccinated. So I would hope, Eva, that by the time we get into the summer and then approach the fall, that at least in the United States, we will have such a low level of infection, because vaccine is the answer. No doubt, vaccine is the answer. Mm-hmm. Then right. The other thing we have to be careful of, because a global pandemic requires a global solution. So we've got to make sure that as a nation, not as an individual person, but as a nation, we reach out with the other rich countries and help countries like India and Brazil and others to suppress the outbreak in their country. Because as long as you have an outbreak in any place in the world, the risk is always that it's going to rebound and come back here.
Yeah.
But with regard to us in the United States, I would hope that if people continue to get vaccinated, that we will get enough blanket of protection over our society that by the time we get to the end of the summer, the early fall, we may not be perfectly back to normal, but we'll be back to normal enough. The kids will be back at school. You can go to a movie. You can go to an entertainment in a theater or in a center that's an entertainment center. Travel. Exactly.
Yeah. There's so much that has changed our lives, and I just I'm so grateful for the work that you've been doing, and you know, you're still in the ring, and we appreciate it so much, and I just hope that this helps a bit. And I want everybody to know that even if you are vaccinated, continue to wash your hands, continue to wear your mask. You know, just try to do your part until we can get those vaccinations, the percentage up. We all still live amongst each other, so we got to do our part. And I hope the vaccination momentum keeps up. People are excited that now it's open and they can all go and get it. There's no restrictions except for age right now. But encouraging everyone to continue to follow public health guidelines and be smart about gatherings and you know, making sure we're taking care of each other as a community.
Right.
But thank you so much, Dr. Fauci. If people need more information, sometimes I feel like they don't know where to go. Where should they go?
Yeah, the easiest thing, Eva, is to just go to your computer and just do cdc.gov.
Great.
And the screen will come up, and in the upper right, it's a little search bar. Type in whatever you want. COVID vaccines, anything you want, and it'll show up on the screen. It's really easy. It's really easy.